is going to be a really exciting night. I love talking about hormones. It's my greatest passion. And, when it comes to hormones, our thyroid gland plays a massive role. So it's a really important one to be knowledgeable about, to understand, to get really optimal in terms of your health. So tonight's going to be a great night to talk all about thyroid, and in particular fatigue, just because fatigue's a really big symptom that we see with thyroid conditions. So a little bit about me. My name is Kim Vance. I'm a naturopathic doctor here in Guelph. I studied at the Canadian College of Naturopathic Medicine in Toronto. While I was there, I was very lucky to be chosen to work on a specialized shift called the Fertility and Reproductive Health shift. So during my internship, I got a little bit of extra training in fertility and hormonal health in particular. And I was able to work with individuals and couples who were having hormonal issues and they were trying to conceive and struggling. And so because of my experience during my internship, I really discovered a passion for helping people balance their hormones. So that's what I do now. I help women balance their hormones naturally. I help them regain control of their reproductive health. A lot of times when we're dealing with hormonal issues, we will see skin issues and digestive issues come up as well. So I am typically helping women achieve clear, glowing skin and get their gut health in order. So I didn't always know I wanted to be a naturopath. And growing up, I was actually quite sick. So, my health issues began over 20 years ago, and I was so sick that I was unable to eat a meal without pain. And I would fast all day. I would avoid eating all day because I knew that if I ate a meal, I wouldn't be able to get through my day. I couldn't get through class. I couldn't get through work, and it became extremely debilitating. And so, I was meeting with specialists. I was having all the scopes done. I was taking all my prescribed medications for over a decade. And really, I wasn't seeing any improvement, and things just continued to get worse and worse and worse. So by the time I started university, not only was I dealing with major digestive symptoms, I had these heavy, painful, and unpredictable periods. I was completely unable to concentrate. My fatigue was absolutely debilitating. It was actually my mother who was shocked when she saw how tired I was. She couldn't believe I could barely read a page in a textbook or vacuum or do anything without having to take a nap. And she, got very worried, thinking something was serious. And I had very significant anxiety. And I didn't really know what was going on, but I thought, why don't I try the birth control pill? The doctors have been asking me to do it for a while to regulate my periods. And I was hoping that might be the answer to all of my symptoms. And unfortunately, within about 2 months of starting that, I developed the worst cystic hormonal acne you can imagine. And I had never dealt with something like that before. So by the time I hit that point, I was embarrassed, I was frustrated, I was exhausted, and I was at a complete loss for how to get better. And it wasn't until my roommate at the time said, why don't you go see a naturopath? And I had no idea what a naturopath was or what they did. But I decided I was at rock bottom. I'm going to go see a naturopath. I'll listen to her. What's the worst that could happen? And so after 3 weeks of implementing all the recommendations that the naturopath recommended to me, all of my symptoms started to disappear. And I was in complete shock and disbelief. And through that process, I learned so much about my own health. I learned how all different aspects of my lifestyle, my diet, even my medications I was taking were affecting my overall health. And I really got to the root cause of why my symptoms were happening. And that's when everything really fell into place. I was finally educated about my body. I knew how to take care of it. And that really was what fueled me to pursue naturopathic medicine. And this is why I'm so passionate about empowering people to reclaim their health now, because I've been through it. I felt awful for years and I didn't get much help from the conventional medical system. And so I feel very, very privileged to work with people the way I do today and help them sort of tread through the waters and get away from feeling so horrible and find some answers for them. So that's why I'm here tonight with all of you. What we're going to cover in tonight's webinar. We're going to be talking about the underlying causes of fatigue and thyroid issues that no one is talking about. We're definitely going to be taking a deep dive into thyroid disorders, and we're also going to be talking about autoimmune conditions. The reason we're going to be talking about that is because autoimmunity and thyroid disease often come hand in hand, and I'll be diving into that a little bit more later. I'm definitely going to be chatting about proper lab testing for your thyroid, because there is a big disconnect in the conventional medical system regarding thyroid testing. So that's something that we need to get sorted. I'll also be chatting about how to book an appointment with our clinic if you're interested. If you're looking for someone to help treat your thyroid naturally, we'll be chatting all about how to book an appointment. I'm actually going to have a little time in my schedule over the next few days where I'll be allowing people to book a free discovery call with me. So a quick 15-minute call where we can chat about your symptoms if you have a thyroid condition, and we can see if we might be a good fit. So I'll chat about that a little bit more at the end of the webinar, but that will be coming at the end in case you are interested. All right, so let's start with this list of symptoms. These are a lot of the symptoms that my patients come into the clinic with and typically are trying to look for some relief. So I'm going to go through this list with you, and if you feel like there's anything on this list that you're experiencing or you can relate to, feel free to type it in the chat box there, just so I can get an idea of how many of you are dealing with these symptoms. First thing, chronic fatigue. And fatigue where it doesn't really matter how much you sleep. You know, if you get 6 hours of sleep or 12 hours of sleep, doesn't make a difference. When you wake up in the morning, you're exhausted, you're dragging your feet all day, you can't wait to go back to sleep at the end of the day. All right, Melissa, she's saying she has all of these symptoms. Okay, so we're going to be chatting more in depth about all of that and why that may be. Are you lacking motivation? Feeling like, you know, there were all these things that you wanted to do, you wanted to get out, get active, get busy, but you just don't have the motivation to do any of that anymore. You know, snoozing all morning, struggling to get out of bed, feeling like that's the last thing you want to do and you could lay in bed all day. Feeling easily stressed or overwhelmed. You know, even small little things can feel so big and leave you feeling so overwhelmed. Brain fog, feeling like you're just trying to think through a fog all day. Nothing is very clear. Having poor memory, struggling to remember things, trouble focusing or concentrating. And I find that this happens to a lot of people, especially students. They'll really struggle to focus and concentrate. Stubborn weight gain despite a healthy lifestyle. You know, you might say, I eat really well, I'm actually quite active, and for some reason I just keep gaining weight and it doesn't really make sense. Or difficulty losing weight. You know, maybe in the past, if you felt like you fell off the wagon, it was pretty easy to get back on track if you would exercise and eat clean, but now for some reason it's not working anymore. Thinning hair, you know, if you're noticing clumps of hair in the shower when you brush your hair, or just straight up hair loss. If you notice eyebrow thinning, especially the outer third of the eyebrow, that's a classic thyroid symptom. If you're constantly feeling cold, you know, everyone is feeling hot, asking to turn on the AC, but you have your sweater on. Being constipated, you know, not having a bowel movement every day, or having trouble with bowel movements in general. Lots of pain, joint pain, body aches, very common complaints. Anxiety, if you're feeling very on edge and anxious and fearful. Low mood, so kind of goes hand in hand with the lacking motivation I was talking about earlier, but just feeling very blah, like you don't want to do anything. Having actual depression, seeing irregular periods. If your periods are totally unpredictable, you have no idea what's going on, when they're going to arrive, when they're going to end. Insomnia. So if you struggle to fall asleep, if you struggle to stay asleep, all of these symptoms can be indicative of a thyroid condition. And, you know, the symptom list seems like it's a mile long, but there's a really good reason for that. So I'm going to be telling you exactly why the thyroid can have such wide-reaching effects on your health, and the symptom list can become so long in just a little bit. So I'm seeing in the chat box that so many of you are saying that you are experiencing all of these symptoms, or at least most of them. And okay, someone's saying here, Tammy, diagnosed with multiple autoimmune disorders. We're going to talk about that as well later on. Chad has 16 of these symptoms. Yep. So this is very common for all of you here tonight. And I will say it's also very common for my patients. You know, sometimes we'll laugh because they'll say, Dr. Vance, I'm so sorry, you know, I should only come in with 1 or 2 issues, but my list, I have like 16 different symptoms. And I always tell them, that's okay. I want to know every single symptom you have, because it helps me really put the pieces of the puzzle together. Because the reality is that most of the time, all of these symptoms are connected, and there's a reason that they're happening all together. So very, very common. Obviously, people aren't feeling well, but there is a way out of it. All right, so let's really get into the thyroid metabolism. I don't mean to turn this into a science class, but it is very important to understand the sort of dynamics of the thyroid, how it works, because it will make lab testing make much more sense to you. And when we talk about why your doctor says everything's normal, but it might not be, this is the slide you're going to see in your head, and it's all going to make sense and click. So first things first, we have the hypothalamus, and it sends something called thyrotropin releasing hormone to our pituitary gland. Our pituitary gland then releases something called TSH, or thyroid stimulating hormone, and that stimulates the thyroid. Now, most of you are probably thinking to yourselves, I know what TSH is. That seems familiar to me. And that's because that's the test that most doctors will run. So typically when a doctor checks your thyroid, they'll run a TSH test, and they'll tell you either it's normal or it's not normal, and they kind of leave it at that. There's one issue with that. Well, there's a few issues, but the first issue, as you can see right away, is that thyroid stimulating hormone is not produced by your thyroid. It's produced by your pituitary gland. So it is a pituitary hormone. It is not a thyroid hormone. So that's problem number one. But TSH, what it does is it stimulates your thyroid to produce actual thyroid hormones. Those two thyroid hormones are T3 and T4. And it does that via a hormone called TPO, or thyroid peroxidase. So I like to think of it this way, and this is how I explain it to my patients. TSH is how your pituitary talks to your thyroid. It's your pituitary gland saying, hey there, thyroid, I think that we need a little bit more thyroid hormone around here. Do you think you could start ramping up production, make some more T3 and T4 for us? Now, whether or not your thyroid actually listens to what the pituitary gland is saying is an entirely different story, which is why testing just TSH is not helpful. It tells us what the pituitary is asking the thyroid to do. It doesn't tell us what the thyroid is actually doing. Now, the other issue here that I'm going to delve into a little bit deeper is the way thyroid disorders are treated. So typically, if we have hypothyroidism, you're going to be given a medication called Synthroid or levothyroxine. There are a few other medications that are used, but very rarely. The vast majority of people are given Synthroid or levothyroxine. And Synthroid and levothyroxine are T4, not T3. So you're not getting T3, you're just getting T4. Now in the next slide, I'm going to talk about why that's really important. So now we're going to break things down a little bit further. Your thyroid has received the message from TSH to produce more thyroid hormone. And now it's going to listen and start producing. So it's going to produce those two thyroid hormones, T3 and T4. The bulk of the hormone it produces is T4. So 93% of the hormone it produces is T4. The other 7% is T3. Why am I being so specific about this? Because T4 is actually the inactive hormone. It doesn't do much in the body. T3 is the active hormone. That's the hormone that all of your cells have receptors for. That's the hormone that's really going to be making change in your body and affecting your metabolism. So our thyroid produces T4 mostly, and then about 60% of that is converted to T3 by the liver. And so it's converted into active thyroid hormone T3. About 20% of it remains inactive, and the other 20% travels to the gut, where it is also converted to T3. One moment here, I'm seeing that we may be having some audio issues. Can anyone write in the chat for me if you are having audio issues? I just want to make sure everyone can hear me. Okay. All right. Okay, lots of people are telling me the audio is fine. If you're one of the people who's having audio issues, there's a few things you can do. You can try and log out of the webinar and log back in. That usually fixes the issue. And if not, let us know. All right. So some of the issues that can happen here. As you can see, T4 needs to be converted to T3, and we need the liver and the gut in order to do so. So if you are not converting your thyroid hormone properly, it might be because we're dealing with liver issues or gut issues, perhaps a dysbiosis or a leaky gut or an IBS. So this is the big connection between the health of our digestive system and the health of the thyroid. It really does impact our thyroid hormone conversion. Similarly with the liver, if we have liver disease, fatty liver, that can really impact our ability to convert. The other issue is that, as I said earlier, Synthroid is T4. It's not T3. So your doctor is giving you the inactive form of the hormone, the form of the hormone that doesn't really do anything, and your body has to convert it to T3. So if your body is not converting well, even though you're taking the medication, you might not be feeling better. You'll still have symptoms. And it's because we're not actually addressing the issue. The issue isn't that you're not producing enough thyroid hormone. The issue is that you're not converting it properly. And that's why proper testing is so important. We need to test more than TSH. We need to test T3 and T4 to see if your production is good. And we also need to test something called reverse T3 that you'll see at the bottom of the slide there, because that tells us how well you're converting between T4 and T3. The thyroid is so much more nuanced than just hypothyroidism gives Synthroid. We really need to dig deep and understand what's really going on in order to get results and feel better. Now, there is one other issue when it comes to thyroid problems that we haven't talked about yet, but is very important. So that is the issue of immune system interference. That's sort of the last piece of the puzzle that can really throw our thyroid off, is if our immune system decides to go a bit haywire. So just to summarize, we can have trouble producing enough thyroid hormone, so we're not producing enough T3 or T4. We can have trouble converting thyroid hormone between T4 to T3. We can have liver issues that mess with conversion. We can have poor gut health that also messes with conversion, or our immune system can get involved and kind of make things a little bit difficult. Every single cell in your body has a thyroid receptor. Every single cell. And your body is made of trillions of cells. So remember when we were going through that list of symptoms earlier, and I said, I'll let you know why that list of symptoms is a mile long. It's for this reason. Every cell in your body has a thyroid receptor. So if your thyroid is not functioning well, then it can affect every aspect of your health, every cell in the body. And that's why being meticulous about our thyroid health, getting the proper testing, understanding what's going on and treating it appropriately is really the key. So you might think, my symptoms are really unrelated. I don't understand how the thyroid can affect my periods or how the thyroid can affect my skin. And it's because of the receptors that are present in every cell. And so our thyroid hormone has to bind to a receptor on a cell in order to exert an effect. And so if there are receptors everywhere, but not enough thyroid hormone, we run into issues. All right, so let's talk about the immune system and the thyroid. So 90% of hypothyroidism cases are due to an autoimmune disorder called Hashimoto's. And I know a lot of you tonight are dealing with Hashimoto's currently. Now, this is when the immune system starts attacking the thyroid when it shouldn't. Our immune system should only be attacking foreign invaders if there are bacteria, viruses, fungi that enter the system that shouldn't be there, that are from an outside source. Our immune system should attack, get rid of them, and help us clear the infection. When we start attacking our own thyroid gland, that's of course an issue. It makes it hard for your thyroid gland to do what it needs to do to produce enough thyroid hormone. And this is happening in 90% of cases. The only way to know if you are dealing with an autoimmune thyroid condition is to test something called thyroid antibodies, which I will delve into a little bit more later. But you need to test thyroid antibodies. If you don't test for thyroid antibodies, you don't know if your immune system is involved. And doctors are very rarely testing thyroid antibodies. I would say that's the test that's run the least frequently in my patient population by their family doctors or medical doctors. And so patients are walking away from their doctor's offices thinking, I'm fine. There's nothing wrong with my thyroid. My TSH is okay. My doctor said everything's fine, but they don't actually know what's going on. They have no idea. They might be dealing with Hashimoto's and the proper testing has not been done. So very, very important to address this because it comprises about 90% of cases, which is the vast majority. So I'm going to talk about the immune system in a little bit more detail. This is a really simplified way of looking at the immune system, but it makes it a bit easier to understand. So our immune system has two different arms, and you can think of it like a teeter-totter. The two arms should be balanced, and one should not be much heavier than the other. So they're called Th1 and Th2. Th2 is sort of like the investigator. So the investigator is looking around, trying to find the source of the problem. Th1 is sort of like the soldiers in an army. Once the problem has been found, they go in and attack and get rid of the foreign invader. However, in the case of hypothyroidism or Hashimoto's in particular, the Th1 system becomes much more dominant and we have an imbalance in the immune system. So this teeter-totter tips over like this. And when that happens, we get a ton of inflammation because our immune system is attacking the thyroid when it shouldn't. There's no foreign invader. Our thyroid should be there, and it makes it very difficult for the thyroid to do its job. And again, when we have a ton of inflammation, we will have all of these side effects that were listed in that symptom list. And so not testing thyroid antibodies and not addressing the immune system is going to leave you still struggling with your symptoms because we're not addressing the root cause. Synthroid, that drug that we were talking about that most people take for their hypothyroidism, does not do anything for the immune system. It is just synthetic T4, and that's it. It does not address the immune system in any way. And that's why so many people, first, they may not even be diagnosed properly, but if they are diagnosed and they're given Synthroid, they still might not feel well. They might say, my symptoms haven't really improved that much. And it's because we're not addressing the root of the issue. So next problem with the development of Hashimoto's is that at least 25% of people with one autoimmune condition have another or will develop another. And that's because autoimmune disease likes to come in pairs or even in triples. And the underlying sort of mechanism that causes autoimmune disease causes lots of different kinds of autoimmune diseases. And so when we leave one autoimmune disease untreated, others can develop. And so it's even more important to be proactive about your health and get properly diagnosed and properly treated. Don't brush your symptoms under the rug. Be your own health advocate. Make sure the proper testing is happening because it can, eke into other aspects of your life. You can start to develop other autoimmune disorders and things can continue to snowball and get worse and worse. Now, there are three things that need to happen in order for autoimmune disease to occur. The first is that there usually needs to be some kind of a genetic susceptibility. So, maybe your mother also had a thyroid disease. She probably had Hashimoto's as well. Maybe her mother had it. Very, very common. The second is you need to have some kind of a major stressor in the body, whether that's literal stress, like say a death, a divorce, a very difficult time at work. All of these things can cause stress, but it can be other things too. A really bad infection, chronic exercise to the point where it's too intense and the body perceives it as stress. Having a very toxic environment where your body is constantly trying to detoxify everything that's coming into the body, and it perceives this as a lot of stress. So it doesn't necessarily need to be mental stress. It can be all different types of stress, anything that your body perceives as a threat. And that can be a lot of different things. And then the third thing that needs to happen for autoimmune disease to occur is there usually needs to be some kind of a gut issue. So usually a dysbiosis, which means an imbalance in your gut bacteria. So very, very common to see digestive issues present when we had an autoimmune condition as well. It doesn't always present with symptoms, but most of the time it does. And when these three things happen, we usually get autoimmune disease. And that's why so many different autoimmune diseases can occur at the same time, because it's the same underlying mechanisms that cause all of them. So here's a list of some common autoimmune diseases that we see. So type 1 diabetes, of course, multiple sclerosis, Parkinson's disease and Alzheimer's disease. These weren't classically thought of as autoimmune diseases, but a lot of emerging research is showing that it is very likely to be autoimmune in origin. Crohn's disease and ulcerative colitis, also inflammatory bowel disease, so issues with the digestive system, rheumatoid arthritis, lots of pain in the joints, endometriosis. So that's when you might have extremely painful periods. You might have issues with fertility, psoriasis. So you'll have changes to your skin. These red plaques will develop all over the skin. Lupus, Guillain-Barré syndrome, which is a neurological condition. Sjogren's is another one. That was listed here in the chat box. So this isn't all of the autoimmune diseases, but it's some of the more common ones that we see. The other thing to be really mindful of is, we don't even understand everything about autoimmunity yet, but there's emerging research that is just giving us more and more and more information to work with. For instance, there's been emerging research lately about the connection between a condition called PMDD, or premenstrual dysphoric disorder, and positive thyroid antibodies. So that is when people who have a period, they may experience extreme mood changes in that week or two before their period. So extreme PMS, essentially. That's actually been linked to positive thyroid antibodies. Something called premature ovarian insufficiency, which is essentially a fancy way of saying early menopause. That's been linked to positive thyroid antibodies. So the body is connected. Everything is connected. All of your symptoms mean something, and we can't treat them in isolation. We have to look at everything together. So we see that thyroid antibodies are so important, of course, for the health of your thyroid, but for the health of all of your organs. So it's very important to get this under control and make sure that you're having the proper testing done. All right, so let's talk about your adrenal glands and thyroid. So your adrenal glands are the glands that produce your stress hormone, mainly cortisol. There's a few other hormones like adrenaline, and it has a very important effect on your thyroid. So when we have big swings in cortisol, that stress hormone, they are typically caused by physical or emotional stress. So I was talking about that earlier. If you have a loss, if you go through a divorce or a very traumatic event in your life, or if you go through a physical stressor, maybe you have a terrible injury, or even you're just working out too hard, you're doing super high intensity workouts for 2 hours every day and your body can't quite take it. So It can be physical stress or emotional stress. And again, even things in your environment, bad infections, these can all lead to big swings in cortisol. And this will have an impact on your thyroid. Now, this is really important because it's very rare that the conventional medical system addresses stress and adrenals when they take a look at someone who's coming in with classic thyroid symptoms. So when was the last time your doctor asked you about your cortisol levels or tested your cortisol levels or asked you about the stressors in your life or your recent breakup? They're not asking those questions, but it's essential to get to the root of why your thyroid might be misbehaving. So here's exactly why cortisol has such an important impact on the thyroid. So firstly, cortisol will lower your TSH. So remember, TSH is how your pituitary talks to your thyroid and asks it to make more or less thyroid hormone. So if your TSH is lowered, your thyroid is going to get the message it doesn't need to produce enough thyroid hormone. It's going to start producing less. It actually blocks thyroid hormones at the receptor sites. So all of those receptors in every cell of your body, they can get blocked by cortisol, and then your thyroid hormone can't attach, and then it can't exert its effect as it should. It also messes with the conversion of T4 to T3, your inactive thyroid hormone to your active thyroid hormone. So addressing stress is such an important part of the equation. We cannot separate the adrenal glands from the thyroid gland. They need to be treated together. And unfortunately, most of us are dealing with chronic stress and major issues in our life. It's just an unfortunate side effect of living in North American culture. And so this is something that I'm addressing with all of my patients, point blank. I ask every single patient about their stress levels, what their self-care routine looks like. We're always working on stress management. I ask all of them about their family history, because again, we talked about how genetics can be very important for initiating autoimmune disease. And I'm always checking in about their digestion and their gut, because again, that's sort of the triad there with autoimmune disease. So these are important things to talk about with any kind of health practitioner, and we need to really change the paradigm of health right now and make sure these things are being addressed and not brushed under the rug. So, which nicely leads into this slide. We are in a bit of a healthcare crisis at the moment. So in 2019, Canada spent $264 billion on healthcare, and 72% of that spending, almost 3/4, was on managing chronic disease. So not dealing with acute issues like someone had a car accident, someone had, an injury. It's dealing with chronic issues that are bothering people for years and years and years and years. 63% of all the deaths in 2019 were caused by chronic disease. So we really need to change the way we are practicing medicine, because we should be getting people well, not having them suffer with disease for years and potentially decades. And the reason this is happening, in my opinion, is that we're using the wrong approach. We are managing symptoms instead of treating the root cause. We are putting out fires, and we are practicing reactive medicine instead of proactive or preventative medicine. It's sort of like you call the firefighters to your house if there's a fire, but you need to make sure that you're checking your smoke alarms and you're not leaving the stove off so that we prevent the fire in the first place. We don't want to start treating when the fire is already burning. We want to prevent it from happening in the first place. And when the fire is burning, no one's concerned about the root cause. Why did the fire start? The number one aim of the game is to stop the fire, manage the symptoms, reduce the symptoms. But just reducing symptoms does not make people feel better in the long run. We're generally missing why the problem started in the first place, and then people end up on medication lifelong instead of living a long, happy, healthy life. So I really think that these need to be changed, and I think that we need to start changing the way we think about medicine. So you have control over your health. A lot of the societal messages we receive today really tell us that your health is in your doctor's hands, or it's all down to genetics and there's nothing you can do about it. But that is not true. The body is able to heal. The body wants you to be healthy. Every single thing that your body does, it does to try and keep you alive and well. And if we support your body, remove any obstacles standing in its way, it can heal. And that's one of the most beautiful things about our bodies. We couldn't create an organism this incredible. We couldn't do it ourselves. Our body is absolutely fascinating and incredible. So we have control over our health. We just need to be proactive. We need to get the right information. And you guys are already doing that tonight. You're here tonight. You're chatting with us. You are learning all about the thyroid and how to properly test it. And that's the first step. It's very important. A lot of that information is kept from society. It's something that only doctors know. They're not really taking the time to have these discussions with their patients or teach their patients because they don't have time. But it's very important to teach people about their health, about their bodies. And actually all naturopathic doctors, they take an oath when they get their license. And that's, there's one aspect of the oath called docere, which is doctor as teacher. So a part of your job when you heal others or help people heal themselves is to teach them how to heal themselves. So get that right information. Figure out the underlying cause of your issues. Don't just, manage symptoms with a Band-Aid. Eliminate any risk factors. This is really important because if we know we have a genetic predisposition, we need to understand the risk factors. Should we be smoking? Should we be drinking all the time? Should we be, really skimping on sleep? Probably not. It's not going to help the situation. Always working to minimize stress, always. We talked about the effect of cortisol on the thyroid, so really important. And take action. Once you're armed with all the information and you're ready to make change, make the change. So speaking of take action, I think I can actually set this up so that a little booking page pops up in the chat box. If you'd like to book a discovery call, I've opened up my schedule for tomorrow and Friday and Tuesday. I have spots where I can chat with any of you who would like to talk to me. You can also speak with a patient care coordinator at the clinic, and we'll be chatting to see if you're a good fit, talking about your symptoms, seeing if we can help you, with your thyroid issue. So when you click on book a free call there, you'll be taken to a calendar and you'll be able to choose a time and a date that works for you, and then I'll be giving you a call at that time and date. So feel free to click on that button there, book a free call if you'd like. All right, so this is sort of what I was already talking about, but really the way we think about medicine is what condition do I have? What drug do I need to treat it? Which is really the fault in how we manage chronic disease. And the reason we think that way is because we've been indoctrinated to think that way. Pharmaceutical companies have spent a lot of money in order to change the way we think and make sure that we rely on medications in order to quote unquote cure us or feel better. But the reality is very few medications actually address the root cause of disease. And so there is a time and place for medication. Some people need it in certain situations, and that's okay. We don't need to feel guilty about that, but there is a time and place. And sometimes it's not the place for a medication. Sometimes a medication isn't, addressing the actual issue. So 2021 was quite a year, as was 2020. So if there was any year where people really started to change the way they looked at health, I think it was this one. And, going through a global pandemic and realizing how important our health is and how much of an impact any chronic or existing conditions can have on our overall vulnerability, I think that really changed the way people thought about their health. I know for myself, I saw lots of people really changing their tune these past couple of years. And this is what we need to focus on, is the pillars of health. We can't just treat conditions with drugs. We need to work on the pillars of health and the underlying foundation in order to feel better. I wish there was a magic pill that would fix everything. I wish there was a magic herb that would fix everything. But the reality is that there isn't. We need to take a holistic approach. We need to address nutrition. It is fundamental to our overall health. We need to talk about our hormones and not just treat symptoms. We need to work on our fitness. We need to make sure that our environment is as toxin-free as possible and make sure that our detoxification pathways are working optimally. And we need to work on stress management. That cortisol, it can really change the game. So all of these things are key, and they have nothing to do with herbs, with supplements, with medications. It's really about lifestyle. That's the foundation that we build on top of. So let's talk about lab work. Has your doctor ever told you that your lab work is completely normal, even though you feel terrible? I think I already know the answer because quite a few people were talking about that at the beginning when we were introducing ourselves, but type it in the chat box there. Let us know. This is something that my patients tell me all the time. We'll have an initial visit and I'll say, has your thyroid been checked? And they'll say, oh yeah, my doctor said everything was fine, so it can't be my thyroid. Or have you just had blood work done? Did anything come up on blood work? Yeah, we did blood work, everything's fine. And I encourage my patients to give me those results even before their initial visit if possible. And I spend time reviewing it with them, usually, 10, 15, 20 minutes. I go through it line by line with them. And I have a completely different take on what their blood work is saying compared to their doctor. And that's because I like everyone's, ranges to be optimal. I'm not just looking to make sure that you're in the quote unquote normal range. I want you to be optimal. And we're going to talk about that a little bit more. So the lab ranges that we use are not the most accurate. And that's because in order to establish those normal ranges that the labs use, they just use bell curves. So they see the population of people who come into the lab, what their blood work results are, and they create sort of a population average. And that's how they determine their normal ranges. Now, this is a problem because we don't have the healthiest population. And so it makes our overall normal range skewed towards an unhealthy portion of the range. And it's really a backwards way of determining if someone is healthy or not. So I use functional lab values, and that's because they're much more sensitive to reveal actual problems. I'm not waiting until the fire is burning out of control to say we have to do something. I'm looking at your labs and saying, you know what? Things could definitely be better. We're moving in the wrong direction. This is telling me that this might be occurring. Let's make sure that we nip it in the bud right now and things don't get worse. And making sure that you are proactive in terms of how you read labs is very important because it can prevent a lot of issues in the long run. And sometimes it can put the pieces of the puzzle together if everything quote unquote looks normal. But if we look at it from the lens of trying to make everything optimal, we can say, actually, there's something going on. This might be signaling this, might be signaling this. So let's take TSH as an example. Even though we were talking about how TSH is not enough to actually delve into the health of your thyroid and understand how your thyroid is working, it's a good example for why your lab tests look normal, but you still have symptoms. So this entire bar that I have on the screen represents the normal range set by the lab. So anywhere between 0.3 to 4.0. It actually used to go all the way up to 5.0, and it was recently changed in the last few years. So the lab started to realize that 5.0 was far too high to be considered normal. So they brought it down to 4. However, if we're looking at your blood work from a functional point of view, trying to make sure that everything is optimal, the range is even smaller than that. It's between 0.5 and 2.5. That's where I like to see my patients' TSH. And so you might have a TSH reading of 3.6 and your doctor would say, yep, you're in the normal range. There's nothing wrong. But I'm looking at that and going, nope, there's something going on for sure. We need to dig deeper than that. So it's very important to make sure that you are going to the right people, making sure that your lab work is being read in the proper way, and that your issues are not being brushed under the rug because everything, quote unquote, looks normal. Often it's not in people's heads. When people tell me, I really don't feel well, but everyone says it's just in my head, there's nothing wrong, I always tell them, I can almost guarantee something will come up on the lab work if you let me take a look over it. So, not just TSH. We can't test just TSH. We have to take a look at what your thyroid hormone production is actually looking like. We have to take a look at your free T3 and your free T4. We also need to take a look at reverse T3. That tells us how well you're converting between T3 and T4. We also need to take a look at those thyroid antibodies, anti-TPO and anti-TG. You may remember from the first slide when I was going through thyroid function, how the way TSH gets your thyroid to produce T3 and T4 is through a hormone called TPO. Now, your immune system can create antibodies against TPO and then make that TPO not work. So if we don't test the antibodies, we have no idea what's going on. Very, very important to test. And I've had family doctors tell their patients that testing antibodies is useless, there's no point. And part of the reason they say that is because their treatment will be the same regardless. So if antibodies are positive or negative, they will still treat it with Synthroid. Whereas when I order this blood work for my patients, I'm doing it very deliberately because I will treat it very differently if antibodies come back positive versus negative. So there is a very key difference in how we approach these different cases. Susan is asking me, can you order these blood tests? Yes, I can. So I order these blood tests very routinely for my patients. I think probably every day I order these blood tests. So a family doctor can order them as well. A nurse practitioner can order them as well, but naturopathic doctors can. So that is good to know. If you need someone on your team who will order them for you, try and find a naturopathic doctor. So in conclusion tonight, thyroid conditions, fatigue, and hormonal imbalances can be managed naturally. So we need to do the right lab testing at the right time. We need to find the root cause of your symptoms. We have to focus on the root cause, not just on the symptoms alone, because that is ignoring, a very important part of the equation. We're just using a Band-Aid. We're not actually dealing with the issue. We need to correct the dysfunction that we see when we're investigating root cause instead of just altering the labs with drugs. We don't want to just give synthetic T4 to make the number go up, but then you don't actually feel any better. We have to address the body as a whole. We have to, make sure we're paying attention to nutrition, to our environment, to stress. We can't just medicate ourselves out of thyroid disease. We can't just supplement ourselves out of thyroid disease. We need to set the foundation for health with those pillars of health that I was talking about. And lastly, you want to have a mentor or a coach or a support system. It is a lot to navigate on your own, and having someone in your corner is really helpful. I do encourage everyone to be their own health advocate, to, empower themselves through information gathering, which is exactly what you're doing tonight. But having someone on your health team can be really helpful. I have Barb asking me, if I order lab work, does it cost money or is it covered under OHIP? Unfortunately, it's not covered under OHIP. So usually patients have some kind of health insurance, which will cover their lab work, and we do direct billing at the clinic. So we can direct bill the insurance company on your behalf, which is really nice. So we have options there in terms of managing lab work. All right, so for all of you who were here tonight, thank you so much. I am so appreciative that you decided to spend these 45 minutes with me. If you'd like to take the next step, I am offering those discovery calls for webinar attendees if you reside in Ontario, Canada. So I've opened up my schedule tomorrow and Friday and Tuesday. You can grab a spot by booking that button up in the chat box that says book a free call. You will see a calendar with times and dates, and you can pick one that works for you, and I will give you a call at that time. So the discovery call is essentially a free consult with me or a patient care coordinator from our clinic, and we chat with you and just determine if you would be a good fit. Can we help you? And we'll figure out what the best date and time would be to come in for an initial appointment. And appointments can be done virtually, over the phone, or in person at our Guelph clinic. We can chat about your concerns. If you have questions, you can ask them during that little free discovery call. And afterwards, if you choose to book an initial appointment, you'll get a quick intake form about your health concerns that you can fill out prior to your appointment, just so we can be better prepared for the meeting. So if you have any personal questions about your particular case, go ahead and book a discovery call. We can chat about it, see if we're a good fit to help you, and then we can go from there. So I am at Natural Choice Medical Clinic here in Guelph. I've included the clinic phone number, email, and website there for you if you'd like to reach out to the clinic, get more info. And for those of you who are local, looks like a lot of you are, that will be really helpful for you. You might be able to come in person. All right, thank you so much from the bottom of my heart for attending tonight. I am so happy to have spent this evening with you all chatting about a topic that's really near and dear to my heart. So I wish you all the best on your health and wellness journey, and I hope to see you in some discovery calls, but if not, continue to be your own health advocate. Use this information, go in there armed with the info, and make sure that you get the right testing and you're not brushing your symptoms under the rug. So lovely to see you all. Good night, everyone.